This is an area of a chronic disease, scoliosis, where most practitioners don't even think about. They basically say, you just got to live with it. There's nothing you can do. Watch and wait. If you're that kind of person that wants to watch and wait, sometimes the news is not good. Okay?
It's almost never good.
It's almost like we're putting our head in the sand. That's reactive approach instead of proactive.
When most people think of scoliosis, they think of kids. However, the greatest population of patients with scoliosis is 60 plus years of age, not kids. Because you have all the kids that never got diagnosed. They're dealing with the problems that
Exactly.
older. Right.
They've been misdiagnosed. They've been gutting. They've adapted, basically.
They've lived their whole
And
life.
to the point now where in their later stage of life, and it's really degenerating.
Yeah. My patient groups are pretty much 20 years and younger because they're potentially progressing and we're trying to prevent the curve from worsening or prevent it from becoming surgical, or 55 years or older. Normally that middle group, I don't see them because they're not in chronic pain yet. They're given the worst advice, and this is the worst advice. And this is, if you guys learn one thing from me, learn this.
Welcome to Rethink My Health podcast and radio show, where each week we come to you from our studios in Atlanta, Georgia, talking about chronic diseases that matter most to you, your family, your loved ones, and as I say time and time again, they do matter most to us, the research scientists, the physicians, the practitioners, in the trenches, day in, day out, looking for solutions, real solutions on getting to the root cause. Over the past several months, we've been talking about cancer, all-time high, autoimmunity, all-time high. We've been looking for different strategies on combating inflammation, thinking outside the box. And our goal here is to educate you, not to replace your primary care doctor, not to give you medical advice, but to empower you, to galvanize you to take action. We're constantly researching, we're constantly looking for disease states in our country that most practitioners may not talk about. Today is a really interesting podcast and show because we're going to be talking about a disease that most Americans don't even realize is increasing. Close to 6 to 9 million Americans suffer with this disease. Some do not even know that there's a solution. I've got an expert I'm going to be introducing to you in a minute. I'm talking about scoliosis. That's something that most Americans don't even think about, but I can assure you for the ones that do have it or have family members, they are suffering and we need real life solutions. Obviously, there's been some amazing advancements in the United States and our medical system. I still believe that we have the greatest healthcare system in the world for urgent care and trauma. We're falling short for chronic diseases. And I'm going to throw scoliosis. I know there's a lot of different root causes. We're going to talk about that as well. Joining with me is a friend and colleague from Max Living, and Progressive Medical has been joining forces with Max Living, which is just a phenomenal organization. We'll talk a little bit about that in just a second. But Dr. Tony Nalda. Dr. Tony, thank you, first of all, for joining me here, Rethink My Health podcast. And I know that you flew from Orlando, so thanks for joining me.
Thanks for having me. It's an absolute pleasure, for sure.
Absolutely a very interesting topic. I know that you've devoted your career. I want to talk a little bit about that. Dr. Tony, founder of Scoliosis Reduction Center in Orlando, and patients are flying from all over the world because he's got real life solutions. So Dr. Tony, let's talk a little bit about that. Take me back a little bit. What really got you interested? I know that you went to Life University, reputable university. What got you interested? Let's start off with chiropractic. Yeah. Because I know the philosophy. What got you interested? Let's go back a little bit. Give me a little bit about your history and how you got involved in this.
Yeah, so what got me into chiropractic was almost like a God's hand reaching out to me in a way. I was suffering with migraines as a child. I had chronic migraines from 10 years old to about 17, and my mom was buying me my migraine medication. I was on about 7. I was injecting myself there pretty much daily with Imitrex at that point. And I'm
very familiar with Imitrex, a lot of side effects.
Yeah, and unfortunately, and you know, being that young, constantly injecting yourself is not a good way to live a young life. And my mom buying me medication in the pharmacy said, "Hey, have you tried chiropractic?" And my mom said, "Well, he never got into a car accident, never had any neck pain, never had any back pain. He has got a migraine problem." He goes, "Well, try it." I went, migraines got better. I want to become a chiropractor. And so that's what led me to chiropractic. And as going through chiropractic college, I learned more about how chiropractic can affect more things than just, of course, migraines or back pain or neck pain and these kinds of things. And coming out of chiropractic college, I wanted to see everybody in the chiropractic care. So I built a relatively big, successful family practice, but I was seeing patients come in with scoliosis not responding the way I thought they should. And there was this big knowledge gap between what scoliosis is, how to take care of it, how many people it affects. What happens to adults with scoliosis is tragic, and there was never actually being addressed in my college education. So I pursued it.
Okay, so let me get an understanding here. So basically what you're saying in a nutshell is that scoliosis is not caught early enough. As they develop into teenagehood and eventually adulthood, this is where you've seen a shift and their disease process is actually worse?
Yes, it's the adult management of scoliosis is horrible. Adolescent management is not great either, but at least it's a little bit better because at least you try to do something. Adult management is pretty much nothing. It's pretty much zero until you get so bad and so much pain, so much discomfort, so many things going on that, okay, now let's go try to put a rod in your spine, which you're probably not going to survive. That's pretty much the way it is. It's ignored the whole time. So,
not to mention the trauma going through the surgery. And once again, let me be very clear.
Yeah.
Our philosophy at Rethink My Health is that we're looking for root cause. We're not against surgery. I know some great surgeons out there. The goal, even every good surgeon talks about this, is that you need to do everything possible to prevent surgical intervention. Use it as a last resort. As I mentioned earlier at the beginning of the podcast, Progressive Medical and sponsoring Rethink My Health. For the past 27 years, this is what Progressive Medical has been talking about, is root cause and doing everything possible to avoid surgery. And I just want to be very clear. Me as the managing director, once again, I just want to say this, Dr. Gez Agolli at Rethink My Health. This show is really about education. That's why I got Dr. Tony on. It's really exciting because, you never really think about talking about scoliosis. This is not one of these chronic diseases you really think about. But as I did the research, close to 9 million Americans. And, I do have a question as we get onto this, is that we'll talk about root cause in a second, but the degree of curvature, that's something, when does it actually become a diagnosis? Because that's one of the big areas. Is that been defined yet? Yeah.
So the actual diagnosis occurs when we have a curve in the spine, anywhere located in the spine, that's measuring in a Cobb angle analysis, which is a specific analysis, a measurement they use. It's very commonly used in the orthopedic world, chiropractic world, to measure the degree of curvature. If it's 10 degrees or higher.
10 degrees.
10 degrees or higher with rotation. That's the key. There must be a little bit of turn or twist in the spine that you can see. Those two combinations, scoliosis. Now, there's several categories of severity, which we can talk about, but minute it hits 10 degrees, it's considered to be scoliosis. If it's 9 degrees, they wouldn't diagnose it with scoliosis, even though it is.
Technically, it's going there.
Yeah, it's there. It's just too small for them to give you an official diagnosis. Okay, so 10 degrees or greater. And the reason why there must be rotation, because if there's no rotation, it could just be postural misalignment. And there's a very big difference between postural misalignment and scoliosis, because postural misalignment doesn't have a twist component. So meaning if you stand and you create a curve, like by standing weird, you won't see the rotation and Cobb angle combination. You just see a shift in the spine that may measure an angle, but you won't see the twist. So that's how you differentiate it on an X-ray specifically.
Okay. So that's important to know. So we're looking at 10 degrees and there's got to be a shift in the curvature, which makes perfect sense. So let's get a little bit more information. So patient comes in, they come to your practice, and now you work them up with your diagnostic evaluation. When do you start thinking about, wait a minute here, what possibly has caused this? I want to talk a little bit about root cause because, there's many chronic diseases out there. Chronic disease is long-standing. We're not talking about acute injury. Acute injury is a little bit different. We're talking about chronic. In your research, Dr. Tony, what have you seen, and have you seen a shift in the last decade where you see more scoliosis? Because we're seeing a lot of different chronic diseases become more prevalent, and we can talk a little about that. But from a scoliosis expert, what do you believe are root causes?
So I think we break down scoliosis into four main categories. right? One, congenital. You're born with a malformation in the spine that is in utero. You're born with that. I think that's 7 to 10% or so.
All right, 10% is congenital. Okay.
Yeah. I would say another group, degenerative, meaning these are adult patients that develop scoliosis in the adult life, but they did not have it as a child. Adult degenerative is typically traumatic. It's some type of trauma that was either unresolved, happened a long time ago, wasn't corrected, and led into a degenerative scoliosis in the adult stage, or mismanagement of your spine over your entire life. You didn't maintain it properly, and you're dealing with degenerative scoliosis in adult life. That's a huge category. Third, neuromuscular. Okay, neuromuscular, you have some underlying neuromuscular disease that's affecting your tissues, either contractures, laxities, some combination of those things that are affecting the way your tissues can support your spine. Right. And there's a neuromuscular component. Now, a clinical neuromuscular diagnosis, cerebral palsy, muscular dystrophy, Ehlers-Danlos syndrome, something like that, you're going to call that a neuromuscular scoliosis. Now, here's the big category. That's about 5 to 7% or so. Is this last group, 80% of all patients, they say, is idiopathic scoliosis. That means unknown cause. Now, the unknown cause could be a little bit of all those things that they just can't find it. Meaning, I see a lot of patients come in my office that have neuromuscular components, but they don't truly have a neuromuscular diagnosis, meaning it's not bad enough. Think of a neuromuscular diagnosis like autism. There's this huge spectrum that right. Some people are so autistic that they know, but some people are autistic, they don't even know. They can't even be diagnosed. So I think it's something along that stage. So I think everybody presents with a little bit of a neuromuscular component. And then underlining is genetic factors. Okay, now they've done studies on identical twins, and you think if it's 100% genetic, every identical twin will share the problem. I have twins that one has scoliosis, one doesn't. I have twins that one has super severe scoliosis, and no one has a very, very mild. So there's other components and other factors that we don't know. Neurological stress, emotional stress, hormonal components, growth rates, toxins. I mean, we can go on and on and on. It is considered to be a multifactorial problem. Something happens that causes it, typically in children. So most cases are adolescent cases that are experiencing problems either during development or growth, or if they get diagnosed. If they don't, they make it into the adult life. And typically in later stage life, 50 plus, 60 years of life, they start having pain, discomfort, they find out they have scoliosis. Okay, so the true relevance of terms of diagnosis, I think it's way underestimated. Because when somebody goes in with back pain, herniated disc, right? They go in the back pain, they get an MRI, they have herniated disc, and they have scoliosis. If the scoliosis is non-surgical, they won't diagnose them with scoliosis. They'll diagnose with a herniated disc. And even though the scoliosis is causing the herniated disc,
they're going to call it herniated disc.
Correct. So right. It's way underrepresented.
Right. So let's talk about this for a second. Let's talk about allopathic medicine. Because, and I encourage our viewers and our listeners on Rethink My Health podcast to always seek the care of an opinion when you have an unknown disease process or pain. You know, possibly, as Dr. Tony's saying right now, there's a large percentage, 80% are idiopathic, right, which means unknown, that you really should consult with an expert in chiropractic care, someone that understands the mechanics. But Dr. Tony, and not that I'm here to be disrespectful of allopathic medicine, it has its place. What would a traditional allopathic doctor do with a patient that we're describing? What typically would their form of treatment be?
Yeah, okay, so this is where I think it's good to talk about the severities and the treatments associated with it. And unfortunately, you have to divide this between adult and adolescent. Okay, so let's talk about adolescent first, because this is when most people think of scoliosis, they think of kids. However, the greatest population of patients with scoliosis is 60 plus years of age, not kids. Because you have all the kids that never got diagnosed, they're dealing with the problems that
exactly.
Right?
They've been misdiagnosed, they've been gutting, they've adapted basically.
They've lived their whole life.
To the point now where in their later stage of life, and it's really degenerating.
Yeah, so my patient groups is pretty much 20 years and younger, because they're potentially progressing, and we're trying to prevent the curve from worsening, reducing it below, or prevent it from becoming surgical, or 55 years or older. Normally that middle group, I don't see them because they're not in chronic pain yet. So they're given the worst advice, and this is the worst advice. And this is, if you guys learn one thing from me, learn this, is if you have scoliosis, don't do what they say is don't worry about it until it's a problem. That's the worst.
Now, are they saying that because they don't think anything could be done with it?
They have no solution.
Okay, that's the reason why.
Yeah,
Okay.
and you'll understand in a second, right? But we're real clear. So mild scoliosis between 10 and 25 degrees. That is any
Now,
curvature.
mild is below 10% curvature.
No, mild's between 10 and 25.
Got it.
It can be 11. It can be 24 degrees. It's still considered mild.
That's still considered mild. Okay.
Still considered mild. No treatments offered for an adolescent or an adult. Zero treatment. They just watch and wait and see what happens.
Watch and wait.
Okay. Now, what's the problem? In an adolescent, when they grow, is when the curve worsens. So what happens is something initiates the curve very young in life. We think somewhere around 5 or 6 years old. Probably starts off very small, 5, 6, 7 degrees. In a typical idiopathic case, they start to grow slowly. The curve progresses slowly. They hit puberty, and boom, when they grow, the curve grows with them. It's not because what caused the curve got worse. That could have completely resolved. But the curve is there now because it's structural, and the growth with the curve, they worsen sometimes. We cannot predict which ones will worsen. So they say, we're going to treat none because we can't predict which ones will. We know curves under 25 degrees, 1 of every 3 during puberty will become severe by the time they're done growing. So about a third. But because we don't know which third will, we treat none. That's the philosophy.
That's your philosophy.
That's
okay.
the orthopedic philosophy. Now, if my child's 1 in 3, right, I would hate for that to be the reason, knowing that I could have done something when it's smaller to ever become severe, but no treatment's offered. In the adult patient, 25 degrees or less, no treatment's offered, period. If they have pain, they treat the symptoms associated with pain or something along those lines. They don't treat the curve. No treatment for the scoliosis. Now, let's say you break 25 degrees. You're going to break 25 degrees during growth, or you're going to break 25 degrees slowly in the adult life as a result of compression of gravity over time. Got it? So it's progressing one way or the other,
right.
Just faster in growth or slowly in the adult stage, okay? Break 25 degrees, now it's called moderate scoliosis. Moderate scoliosis in the adult patient, it's the same as mild. No treatments offered. This is between 25 and 45, roughly. That 45 can be plus or minus 5 degrees, which I'll explain in a second, in this moderate stage. No treatment for the adult. Even if they have documented progression, nothing. Don't worry about it. If it gets worse, come back. And when if you're debilitated.
And they basically mostly on pain functionality.
Symptoms. Pain symptoms. 100% pain symptoms.
All pain symptoms.
All pain symptoms. They can do things to help that could be a result of your scoliosis. You could have herniated discs. You could have knee problems. You can have hip problems. Very common. Hip problems, knee problems, foot problems. They do knee replacements. They do hip replacements. They do all these crazy stuff. But the scoliosis is causing this imbalance that could be leading to the whole thing.
And they're not even looking at that.
Not even addressing it.
Not even addressing it at all.
Not even addressing it in the adult patient, which is crazy, but that's the way it is. And the adolescent, if the orthopedics believes a little bit in conservative treatment, they would recommend a brace. It's about 50-50. And the brace they'll use is one of 2 types, Boston brace or Providence brace. These braces are built to try to slow down the worsening. They're not trying to reduce the curve. They're trying to make it better.
To slow it down.
Slow it down. And now the reason why they'll do it now and not do it under 25, because once you break 25 degrees, 66% will worsen during puberty to become over-surgical, and 33% won't. So since the numbers switch, we're going to now brace everywhere. That's the thinking. Now, the studies regarding Boston braces and Providence braces are not great. They show about 20% effectiveness. Okay, about 20 to 25% of people it will slow down. We already know a third of them are not going to worsen anyway.
And that's if they're compliant.
That's if they're compliant.
I was about to say that. If they're not compliant, it goes severely down, right?
Yeah, it potentially can go worse. And these braces are just not designed to make people better. So kids get very frustrated because they're not seeing results. They're not getting better. It's kind of like putting a child in braces for your teeth. And the best you can ever expect is that it's going to slow down how bad they look. It's not very motivating, right? Because it's not results driven, right? It's the opposite. It's like, let's not hope it doesn't get worse. Now, let's say it becomes severe. Severe, now it breaks 45 degrees. Now, these categories, mild, moderate, and severe, I want to say something about.
So 45 is severe.
Is severe. Has nothing to do with how much pain you feel. This is important because if you think mild curve, you think mild problem, right? These are surgical categories. They have nothing to do with function or pain. You can have severe scoliosis, no pain or no symptoms. You can have a mild scoliosis, severe pain and symptoms, okay? And I'll explain why I think that is in a second, okay? You break 45 degrees, now they call it severe. In the adolescent, you're in puberty, they're going to recommend surgery pretty much immediately because they know every single time you grow, about 96% of the time, you're going to continue to get bigger, and they don't know where it's going to stop. Unfortunately, the biggest curve I've ever treated, 155 degrees in a child.
Wow.
155 degrees.
Well, we'll come back to it in a second. I want to hear about the outcome there.
Yep, 155 degrees. Okay, got it. Now, in the adult patient, if you have 45 degrees and no pain, no symptoms, nothing. If you have 45 degrees and mild to moderate pain, they'll treat your pain and symptoms. If you have 45 degrees and debilitating pain, now they'll consider spinal fusion and surgery. And that's when they run down your rod down your entire spine and they immobilize the spine. Spinal surgery is indicated only in severe cases, severe over 45 degrees, right? And they know, and the reason why they're waiting, and the surgeon will tell you this, they have to wait for the scoliosis to become this bad before they can consider scoliosis surgery, because scoliosis surgery is a non-functional treatment. They're immobilizing the spine. Your spine will not be healthier. You won't have more mobility. You won't have more functions. You're going to have less. But they're willing to compromise it at that point because they know, untreated, the curve will continue to get bigger.
Right.
Got it. So that's the reason why they're doing it. So that's it. In adolescent, nothing. Bracing if you're in the moderate stage, or surgery. Adult stage, nothing until you become in disabling pain, and then they'll consider spinal fusion.
So let's talk about this for just a second. Okay, so you set this up from an allopathic rule. They get to this point, wait and see a lot of the different times. A lot has to do with pain, and I understand nobody wants to be in pain, of course, and they'll probably prescribe some type of NSAID or pain management, one medication, and there are side effects with that as well. Let's talk about surgery. Now, for those that opt for surgery, number one, we're talking about rods going into their back. Okay. What is the success rate that you have seen with patients that go that route?
Okay, so this is a very complicated question, and this is probably the patients I treat, they don't want to go down this route. They just don't want to have this option because they've looked into it. We don't know. That's the best way I can answer it. The success rate for children immediately following the surgery, meaning they survive the surgery and they succeed for 5 to 10 plus years, is relatively high, meaning 98% may have will succeed, 1 to 2% will have a negative reaction, where they may have to remove the rods, maybe redo the surgery. But the problem is we don't know what happens after that. So these are kids, 10, 12, 13, 14-year-old kids. They're getting their spine immobilized, and we have no idea what happens to them 20, 30, 40, 50 years from now. No one knows. No one knows. And that's the scary part. And there's a lot of debate. They could be better off with just their scoliosis and not the surgery, because we know no surgery lasts forever. No hardware lasts forever. You're going to have a revision. You're going to have something done, and it's going to be probably more complicated.
So there haven't been any new advancements in surgical technology with this?
The surgery has gotten better because of the invention of the pedicle screw. Okay, got it. Because now,
but just because of the screw.
Just because of the screw. Now they're not using hooks anymore. They're using screws, so they don't pop out as often. I see lots of adults with Henderson rods that the hooks pop off. But so that's
what do these X-rays look like? Pretty bad, huh?
Oh yeah, I mean it's like, I don't know. It's the way I would imagine if I was a contractor, I was going to go rebuild a house that was built in the 1930s. How do you rebuild it? Like it's all coming down. Like there's you're so limited at that stage.
Good analogy. Yeah.
But that's what you're dealing with. So that's the hard part, is what are they better off with? So when you define success? Is success means you stop curve progression? Because that's the only reason why they do it, is to try to stop curve progression. You can have pain afterwards. You can have surgical failure. You can have more discomfort, more problems. But you stop curve compression, is considered successful, right? But could there be other ways that we can stop progression?
So stopping the progression. So this is very important to understand. Hey, this is Rethink My Health podcast. We're talking about scoliosis. We're looking at root causes. And, obviously conventional medicine is limited in this area. So if you or a loved one, or if you know anybody that's suffering with this, or if you've not been evaluated, I think it's important, because we'll talk a little bit about this, because we're about to go to a break in a couple of minutes. I'm sure there's a lot of Americans out there that don't even know they have it, right? They're walking around probably clueless that they have it, okay? And we'll talk a little bit about what you can do about that. But I think it's very, very important to know there are some options. After the break, we're going to be tackling some other natural, non-surgical options that Dr. Tony has developed and perfected. He has other colleagues as well. Dr. Tony, just very, very quickly, since you're practicing in the United States, I know you have international patients. Have you done any studies or just research about other countries percentage-wise, United States, how bad are we with scoliosis compared to other countries?
We have the highest surgical rates in the world when it comes to scoliosis.
So we do.
Far.
Okay.
100%.
That answers the question right there.
Highest rates in the world. So unfortunately, most of my training in scoliosis had to go to European countries to get the training because at least they are more conservative minded. Right, and
so they're looking for their options.
Yes, because it's the unknown. It's the unknown of this rod putting in in a child's spine, and we know the results are horrible for adults, which I didn't even go down that road. They did a study trying to do surgeries in elderly patients. They had to stop the study after a year because people were dying. So it's a major thing. So it's so underrepresented of how bad this problem really is, and how many people actually suffer with it.
Yeah, that's really heartbreaking to hear that. Well, there is some hope. Hey, this is Rethink My Health. This podcast is really about education. This podcast is about empowering you, the listener, to take action, getting to the root cause. It's an investment of time and resources, but that investment of good health is worth it. Dr. Tony, an expert on scoliosis, there is some hope. We're going to talk about some of his success stories. We're going to talk about some of his treatment philosophies. At Rethink My Health, sponsored by Progressive Medical, this is all we think about. We think about root causes. We're thinking about making your life better, one step at a time. This is Dr. Gez Agolli, your host. We're going to be back in a moment on Rethink My Health. Hey, welcome back. Rethink My Health podcast. What an exciting segment. Talking with Dr. Tony Nalda. Talk about scoliosis and just going over some of the treatment options. And, as I mentioned earlier, 6 to 9 million Americans and they're diagnosed and most of them don't even know they have it. Talked about some of the outcomes with surgical interventions, just really kind of unknown. Dr. Tony had to think outside the box and go to other countries to get some of this education. And I'm glad to hear that you wrote a book, Scoliosis Hope, and exploring adult scoliosis. Before we get into some of the treatments that you offer at your center and you personally, let's talk a little bit about the book. I know that you wrote this book mostly in a patient-friendly manner to educate patients. Talk a little bit about the book, what inspired you, and where it's available.
Well, it becomes so confusing, right, regarding how to treat scoliosis, because you go into an orthopedic doctor and they say, oh, don't worry about it or do nothing. And then you feel like as an adult or as a child, like, I want to do something. I don't want to just leave it to a chance that will this curve worsen during growth or during puberty, or do I want to leave it to worsen as in the adult stage? Could I do something now to help myself? And when most doctors say can't do anything, no chance. Like don't waste your time. They literally give you zero hope in terms of like you have any influence on your health and well-being. And I was like, scoliosis patients, there's a tremendous amount of hope. There's so much that can be done. So that's where the motivation of Scoliosis Hope came from. That there's definitely hope. You can live a normal, healthy, long life with scoliosis if you properly manage
non-surgical.
Yeah, non-surgically.
Okay.
If you manage it properly. It's the worst advice ever given to scoliosis patients. Don't worry about it, and see what happens, right? And then adult patients, because the adult, like when I got into it mostly dealing with children, but when I really started diving into caring for patients, it was the adult population that was so underserved. And so now my practice is pretty much 50-50. It's a half adults, half kids.
50-50.
Yeah.
Okay, that's important. And I'm glad you wrote the book as well. Is that available online?
Yeah, it's available online
okay,
on Amazon.
Wonderful. Okay,
Yeah, sure.
Scoliosis Hope by Dr. Tony Nalda. All right, so let's talk a little bit about now that we've gotten the surgical aspect. And I like the fact that you're saying a lot of these studies, especially for the adults, they have to stop the study because the outcomes were not good. And we just don't really know with what's going to happen in 40, 50 years with some of these children with surgery. And it's also very difficult to go that. All right, so now we know that scoliosis, a lot of scoliosis, 80% that you've mentioned earlier, are idiopathic, which means unknown. Multifactorial. I'm more of a multifactorial person anyway. Just give me a couple ideas why we're seeing this prevalence of scoliosis increase in our country from your experience as well. And then early intervention is always the key. But give me some of the root causes you think that you've seen.
Yeah, so definitely neurological stress, right? We know any type of neurological stress, any type of trauma to the spine will express itself potentially into a curvature, right? Any type of neurological insult, right? traumatic. I mean, we have traumas constantly with our devices and our phones that are happening all day at younger and younger and younger ages. I've been doing this for 30 years. When I first started practicing, I never took an x-ray of a kid with a bad neck, almost never. I take x-rays of kids now, they almost all have bad necks. Right, I mean, all of them, almost all of them.
You think a lot of that has to do with these devices?
I'm convinced.
And the fact that they're not getting the outdoor activity.
Any sunlight, any of the
sunlight,
stuff,
all of that. So there are some nutritional components as well.
100%.
Especially
all the neurotoxins we're eating,
absolutely
affecting our nerve system.
Our microbiome has been affected. You've got tons of glyphosate. You've got all kinds of nutritional imbalances. So we agree with that 100%.
100%. Hormonal imbalances that can lead to asymmetrical development. There are theories that maybe the bones of the spine and the spinal cord are growing at asymmetrical rates, leading to spinal cord tension, and the body's creating a curvature to protect itself, right? Just like a fever, like the body will respond, and that curve sits there. It sits there, and then boom, you go through puberty and it takes off, right? So we know something initiates this curve much younger than it's actually diagnosed. Every case of adolescent scoliosis is a case of juvenile. They had it as a younger child. They just didn't find it, didn't see it. It's not until it gets big enough to where you can visually see it.
Okay.
But that's what brings on the diagnosis. It's not the kids go, hey, my back hurts, you take an x-ray. It's you see it the way they stand. You see a shoulder higher, you see waist asymmetry, you see rib imbalance, you see waist, you see asymmetry, and then the parents think, oh, it's not that big of a deal, and then it gets getting bigger and bigger and bigger as they grow, and they're like, okay, let's take it, and they take an x-ray. Average size of diagnosis is typically in the 30s, right? It's not, we very rarely, but even if you catch it early, they don't do anything.
So from a public health perspective, right? So if we can write public health laws or recommendations, getting an evaluation at an earlier age is probably one of the best things.
Yeah, or as a parent, being very mindful of looking at it, or looking at your kids while they grow and develop, and know there's never a normal reason to have asymmetry from the left to the right. There's never a normal reason to have one shoulder higher than the other. There's never a normal reason to have ribs stick out on one side and being in on the other. There's never a normal reason to have asymmetrical waists or your arms hanging asymmetrically away from each other. Unfortunately, I see kids that come in, their pediatricians miss it. But they a lot of times parents rely on the school physicals. The problem is kids grow at different rates and at different times. So if your kid goes in there pre-puberty, oh, it looks fine, and then they have a growth spurt after the physical, right, and they don't get another physical for another year, that curve can go from undiagnosed to severe in that 1 year period of time.
Wow, it happens that quickly.
Yes, fastest progression I've ever seen is over 60 degrees in less than 6 months.
Wow.
I've seen 20 degrees in 8 to 12 weeks.
Wow, that's amazing.
Yeah,
okay.
It's like because kids go through rapid growth.
Okay, absolutely. Any other root causes you've seen?
Yeah, so some combination of and then of course traumatic, like some kind of trauma, obvious trauma. But there is, underlining neuromuscular components. It's a multifactorial component. We know it. It's like looking at whatever causes it. I honestly believe the body responds and recovers, but the curve sits, and it's untreating that small curve. What leads to severe curves is untreated small curves, because what every severe curve has in common, it was once small. The curve I saw was 155 degrees. It was probably under 10 degrees at one point.
Wow.
But it was just never caught and never treated.
Right, just get worse and worse. Okay, so now we established that. I want to have a little bit of idea. Take me back when you had that aha moment. When did you have that aha moment that you can make a difference?
It was a combination of going around and visiting some doctors that focused on scoliosis. And one of my mentors is Dr. Wogan. He's unfortunately passed away. He's the founder of Clear Institute. And Clear Institute is a nonprofit that certifies doctors in doing scoliosis treatment. And the only chiropractic certification, as far as I know, that focuses only on scoliosis. I'm currently the chairman of the board of the nonprofit. And I went to go meet Dr. Wogan, and he showed me some patients that he was treating that were reducing a curve and showing results. And I took one of my patients. So this was what got me into scoliosis. I had a patient of mine that was a competitive horseback rider. And she was a equestrian, competitive equestrian rider, and she had a scoliosis, and I was taking care of her, and the curve wasn't responding. I was doing the things I thought was right, but I just didn't know. I went with her to this doctor's clinic, and I spent a week there looking at what he was doing. I said, this makes sense. Like, I can see how this can make a change. And I took that foundation, and I was like, okay, well, what can we do to expand it? And I kept expanding and expanding and expanding and expanding the treatment model into what we have today. But that's when it was started. It started with that one girl, right? And funny now, my wife has scoliosis. One of her daughters had scoliosis that we treated and we reduced it, and she never became surgical. The pediatrician wrote me an email saying, "How'd you do that? It's not possible." I go, "Well, it's possible. You just got to use the right components." So now it's like in my family. But what got me into it was one of my patients. What's really got me going.
That's great. So I'm glad that's very inspirational to hear that kind of story. All right. So now I want to hear a little bit of Dr. Tony. What percentage of the patients that, let's go really severe right now, the ones that their orthopedic surgeon said, don't worry about it, there's nothing you can do. Sometimes that, of course, parents are going to believe their physician, and they might lose all hope. What percentage have you seen that are really severe, that you've seen some positive outcomes?
Yeah, so my average patient is a 60-degree curve. So my average patient I'm treating has been told they need surgery, and they're looking to reduce it. Most of my adult patients are 60 degrees. They say you're in bad pain, you have problems going on. You can consider surgery, but you're going to have a bad outcome. So most of my patients are surgical. Unfortunately, I'd much rather treat 25-degree curves and less because we can make obviously a huge impact. So most of my patients, 80 plus, surgical level curves. We get 95% of patients get our curves reduced, and most of them get below surgical levels if we get them before 60. We average about...
That's the key.
That's the key, before 60 degrees.
Give me an idea of let's talk about a patient that's really compliant, right?
Yeah.
Your model patient that does everything by the book.
Yep.
What time period are we looking? I'm just looking at gauges right now.
Got it. So let me give you what I think are my percentages. I know my percentages on my average patient, which is my 60-degree curve. So curves 25 degrees or less, I believe we're going to average between 60 to 70% reduction in that curvature if they're compliant, especially in an adolescent. In a young adult, we'll do very well with them as well because they're very flexible. Older adults, don't do that much. We'll do about 40% reduction. But adults are typically looking for functional and pain reduction. We'll almost always get it, like 95% of the time we will. When you start breaking 25 to 45 degrees, my reduction won't be as high. It'll be like 40% on average in adolescents. Adults will be a little bit less, like 30. Okay, when we start getting to 60 degrees, between 45 and 60, those, my adolescents, we're averaging about 30%. Adults are averaging around 25. Okay, these are compliant patients that are following the program. Most kids, most treatment times are about a year to 18 months. We're treating for about, think of like braces on your teeth. It's very similar. We have to create body neurological remodeling, right? About 18 months, we wean them down, and then we do what we don't do, what orthopedic doctors do. We don't say, don't worry about it, you maintain it. We do a little bit of home maintenance. You do a little bit of home therapy. We do yearly to every other yearly little evals to make sure we're not seeing any change. And if we see any type of change that occur because of gravity, that's what's causing it to progress in the adult is gravity over time. We respond with a little bit of treatment and push it back down. Kind of like you gain like 5 pounds of weight, you lose it again, and don't gain 30. Right?
So what about these patients that don't live in your area? How often do they have to come and see you? And I'm assuming that you've got protocols for when they go home.
Oh yeah, 100%. So most of my patients, 70% of patients do not live in Florida. They don't live in Orlando. They are flying in for care. I see patients pretty much, I don't know how many different countries, but many different countries. The treatments, thankfully, are considered short burst treatments. So we do small bursts of treatment with stabilization in between. So most of my patients are coming for a 5 to 10 day treatment. Then they're going home for 6 months. They're returning back for a 5-day treatment. They're going back for 6 months. And we're typically doing 2 to 4 of those, depending on the person. And then we're weaning them out, okay, in an average patient. Now, let's say I've treated kids 4, 5 years old with 70-degree curves. We're treating them until they're done growing because they can worsen at any time. So I got to reduce them, but then we're not, that initial...
maintenance.
Yes, that initial 18 months is the most work, but we're not letting them go until they're fully done growing.
Are you using any devices like braces or any other structural devices?
Yeah, we use many. It's funny. I kind of walked through your clinic and it was amazing. And I was like, that kind of looks like if you went to an average chiropractic clinic and then you walk into my office, you would be like, okay, now I see why he gets all the results with scoliosis. Because this is like walking into an average medical clinic and walking in here. It's like, okay, now I can see why you get the results you get. Because you have this multimodal approach, and that's the key. It's the same thing with scoliosis. You can't just do chiropractic care. You can't just do therapy. You can't just do bracing. You can't just do exercise. You can't just do vibration. You got to do all those things and combine them in a systematic way so every treatment adds to the next. Just like you do here. And I was like, it makes sense.
Yeah, it makes perfect sense as well. So where do you see, let me ask you this, Dr. Tony, as we're wrapping up this show, what an exciting show on Rethink My Health podcast. This is exciting. This is an area of a chronic disease, scoliosis, where most practitioners don't even think about. They basically say, you just got to live with it. There's nothing you can do. They only watch and wait. Those are the terms that, some of the individuals look at and hear and they say, okay, that's great. I can watch and wait. But if you're that kind of person that wants to watch and wait, sometimes the news is not good. Okay.
It's almost never good.
It's almost never good at all. It's almost like we're putting our head in the sand. That's reactive approach instead of proactive.
You got it.
And you have to be proactive in a disease process such as scoliosis. It's becoming more prevalent. We're seeing it now more. We're seeing more and more nutritional deficiencies, toxicity all-time high. Environmental Protection Agency put out a report 2 years ago for over 4 billion pounds of chemicals in the water, in the air. Now, I'm not saying that causes scoliosis. It certainly doesn't help it, right? But now we're seeing all of these different devices, electronic chaos. We can talk about EMFs that are contributing to this. The bottom line is this, that you have to be able to do something and be proactive. And if you or family have scoliosis, there is hope. And that's what's exciting, Dr. Tony. I love your approach. It's a multifactorial approach. Let's finish up. I want to hear a little bit about your vision. Did you have any vision that you can see that you can make your protocols better?
I do. I think if I had two main things. Number one was to push back the surgical guidelines to 60 plus. I think doing surgery these days at a 45 degree curve is crazy because the amount of research, even with my studies that I've put out, that we've taken curves and reduced them that are 60 degrees or less. Because if we average 30% reductions, we can get a 60 degree curve below 40. Therefore, that's considered non-surgical. So I think we should push the surgical numbers up because we're doing way too many surgeries with the unknown results 20, 30, 40, 50 years from now, right? And two is to change the way it's managed. That scoliosis, telling patients to not do anything and watch and wait and deal with the effects later is it's crazy. We don't do that with any other disease. We don't say, oh, you have a little bit of cancer. Let's just see how bad it gets.
Yeah, exactly.
Yeah, I mean, like we treat it when it's small because that's when patients are most acceptable. And and their argument is going to be, well, maybe you're going to treat a curve that never becomes surgical. And I go, well, that's the whole point. And there's never harm in making a 20 degree curve 10. But letting a 20 degree curve become
you're making their functionality even better.
Correct. You got it. There's no benefit to gain to let a curve become bigger. And those are the two things that is my lifelong mission to change. Push the surgical numbers up because we can reduce curves.
Can you think about a young athlete, a young aspiring? You have a lot of kids out there that are aspiring to be athletes. Have you seen anyone that was an athlete that you got on treatment and they noticed a difference in their performance?
Oh, 100%. I've had many high school students. In fact, my average patient is an adolescent, is a 12 to 14-year-old girl, typically a dancer, gymnast, or volleyball player, right? They don't be very active, but they notice asymmetry, right? They notice that they don't have the same movement and coordination. You balance them out, they get better. And not only do they get better functionally, they get better aesthetically, which is also very important. So right. better positive outlook on their life and all those things. And we're keeping their spine in a better position so it doesn't have the biomechanical load that it's going to have. And what that leads to, there's already been studies knowing that when your spine's out of alignment, your neural output on spinal posture is increased. So your body has more stress, more cortisol releases. So having better alignment produces so much more health overall. So I mean,
better attitude, better
everything.
Function, better performance, and that's really what it's all about. This has been a very enlightening conversation. Rethink My Health, Dr. Tony. I'm really excited. I'm glad that you're the chair for the organization to make a positive impact as well. Is there anything else that you want to share with our viewers and listeners that you are passionate about? You obviously are a very passionate practitioner and a visionary, because I think that's what it takes to have change. Anything else you want to share with us that you think is important?
Yeah, I mean, if you have any feeling that you have scoliosis, minimally get it checked every year, right? You should get an X-ray every year to year and a half. The dose of X-ray today is so little. It's like being on an airplane for
Yeah, absolutely.
It's irrelevant.
The old days are it's much less radiation.
Yeah, it's not even considered a problem at this
totally
point.
Agree with you.
Yeah, get an X-ray every couple of years and know, because when I get an adult patient, I'm going to ask them, do you have any X-rays? They say no. Do you have any idea what your curve was 20 years ago? No. So we don't know how much they've been worsening. And so we're a little bit.
It's hard to really tell then.
Yeah, but they know because their posture's gotten worse, their waist has gotten worse, their ribs have gotten worse, their shoulders have gotten more balanced, their head's gotten more forward. So they feel like they've gotten worse, but we don't have numbers, right? And what I find, so what I notice with adults, and this is what I believe what happens, is kids have no pain with scoliosis. So the 155 degree curve that I dealt with as a kid, no pain. But adults almost always feel pain. Why? Kids worsen because they grow. Growth doesn't cause pain. You adapt and grow around the curve, causes no discomfort and pain. Adults progress because they collapse. They're compressing, almost always cause pain.
Is it the compression that's causing this?
Yes.
So the gravity is making a big impact as well.
Yes. So you can progress 5 degrees as an adult, have pain, progress 100 degrees as a child, have none. So it's the progression, not the size in the adult stage. You can have a mild curve and have severe pain in the adult stage. They go say, oh, you have a mild scoliosis, don't worry about it. But you may have worse than 10 degrees as an adult, and that's the reason why you're in pain. But they don't look at that. It's a static scale for them, mild, moderate, severe. But you're you. So if you worse than 10 degrees as an adult, that's a lot for you. So therefore, you have pain and discomfort. So that's why it's important for you to check it no matter what classification you're in. And if you're seeing changes, that could be the reason why you're experiencing things and your orthopedic is saying it's not a big deal.
Well, being in your profession, in the chiropractic profession, which I know there's been some great advancements with chiropractic care as well, and technology, and being more available to the average American. Do most chiropractors even obviously learn this in school, but they don't really take it to your level?
No, and this is another mission would be for me to educate chiropractors on what scoliosis really is. They treat scoliosis more like a segmental misalignment. We're taught about scoliosis, but we're not taught effectively to treat it. In chiropractic college, we're trained to refer them to an orthopedic surgeon. That it's a non-treatable condition as a chiropractor means I can't reduce the curve. However, I'm a chiropractor, I'm reducing it. Why? Because I'm doing a lot more techniques than just a chiropractic.
But I consider yours more corrective action.
You got it.
Okay.
Yeah.
And it's more than just treating a subluxation, which is important, of course, which is based on the philosophy of chiropractic care and having that spine in alignment. But really, there's a corrective action plan. And to hopefully not only reduce that curve, but to strengthen that body and also the patient's constitution. Because to me, someone's got a strong constitution and they become more resilient. As you mentioned earlier, we tend to, as humans, adapt. And that could be a good thing and also a bad thing. Because when we adapt the wrong way, we don't see things happening until almost it's too late.
Yeah.
And that's why, pain and symptoms are just an expression of that disease process. And that actually will alert you to take action somewhere. And sometimes, most individuals don't do that. Nobody wants to be in pain, right? They'll reach for medication. And I'm not saying they shouldn't do medication. I don't like it, but that's really not solving the problem. It's masking it.
It's masking it, yeah.
And that's one of the reasons why I like what you're doing. And I think I want to continue to support what you're doing as well. And I agree with you that part of the vision should be, and that's something we talk about Max Living, of course. I know I've heard you speak before there, and you're inspiring other chiropractors to follow that. Got a couple minutes left, and I know that, give me also another idea. How can someone get in touch with you to get to your office in Orlando?
Yeah, so easiest way is obviously just go to my website, scoliosisreductioncenter.com, and you can reach anybody there. We'll gladly help you. We see patients respond typically very, very quickly. Fill out any type of intake. I'd say typically the easiest way. You can call the clinic, Scoliosis Reduction Center. I have my own website, drtonynalda.com. Any one of those.
And you also have a YouTube channel too of education too.
Yeah, I have a Scoliosis Reduction Center YouTube channel. And in fact, a lot of people find me on my YouTube channel. I probably have hundreds and hundreds of videos.
And I just want to let you know that you're going to be going to Italy speaking.
Yeah, I'm going over to Italy, going to SOSORT. SOSORT is the largest conservative movement for spinal deformities, and scoliosis is considered.
That's exciting.
Yeah, and
would you consider Europeans a little more advanced in this area?
Yes, I really do. I do. And that's what kind of got me into this, moving into this European field, because you asked, do I use any of the devices like bracing? Well, I was anti-bracing for 20 years because I said braces don't work, because the only thing I ever dealt with was a Boston brace, because they don't work. But, it's kind of like a car. A car is designed to do what it's designed to do. A Jeep can do something, but a NASCAR car can do something completely different, right? Or a Formula One car. So whatever.
Or high performance.
Correct. You got it. So then I said, well, It's not that braces don't work. It's just those things don't work.
Right.
So we design our own braces. We design our own. So we take it every piece and we put it together.
So you're fine tuning that individualized care for that individual based on their needs, which is really the key. There is hope. If you have scoliosis, if you're in your late 50s, 60s, and you've been told there's nothing you can do, check out Dr. Tony Nalda's website at the Scoliosis Center, and good things are going to happen. You're being proactive instead of reactive. Dr. Tony, thank you so much. I really appreciate you coming on Rethink My Health. And tuning in next week, we're going to be talking more about root causes. We're going to be tackling other diseases. We've talked about cancer all-time high. We're going to be interviewing some patients. We're going to find out some patients on their journey, because every patient's different. Everybody's individualized. And that's what I love about functional integrative medicine, is that we're looking for root causes. We're finding out different therapies, not just trends. We're really making an impact. We're living in very exciting times right now in the United States. Why? Because Americans want this kind of medicine. Americans are tired about the status quo. They're tired about saying, just take this pharmaceutical. Yeah, there's a time, place pharmaceuticals, but really your temple, your body is made to design to heal itself when it's back in balance. I've said this before, it's called homeostasis. Everything's in balance internally, regardless of external factors. Guys, thank you so much. This is Dr. Gez Agolli. Once again, Dr. Tony, thank you so much, buddy. I really appreciate it. And remember, a cheerful heart is good medicine, but a crushed spirit drives the bone. Proverbs 17:22. God bless you guys. Don't be crushed. Continue thinking outside the box here at Rethink My Health. Dr. Gez Agolli one more time. Sponsored by Progressive Medical. We will see you next week.